Awesome. Welcome, everyone. Thank you for joining us again this week. It looks like if you've tried to join us the past couple of weeks and had some issues with links, it looks like we have that figured out this week. Thank you for bearing with us. We really appreciate your continued attendance and your continued interest in the Ignite Speaker Series. If this is your first time joining us during this fall, I'd like to introduce myself. My name is Matt Hawthorne. I am one of the Ignite Graduate Innovation Fellows here at Clarkson. I have started this project with a few other Ignite members, and we're really happy to introduce our fifth speaker of the fall 2020 Clarkson Ignite Speaker Series. This is a continuation of our second mini-series on UN Sustainable Development Goal number 3, which is good health and well-being. And for this talk, we're going to welcome Dr. Vicki Lefay. Dr. Lefay is a clinical associate professor and the physical therapy program chair at Clarkson University. Her clinical practice and areas of expertise are focused on worksite injury prevention, rehabilitation, wellness, and ergonomics. Dr. Lefay has served on numerous national and state professional association boards and task forces, and she is currently the chair of the New York Physical Therapy Association Practice Committee and a recent delegate at the APTA House of Delegates. She has also published and presented at the state and national level on topics such as PT student clinical performance, collaboration, and best practice in PT clinical education, students as knowledge brokers for clinical practice, and PT clinical education leadership. With that, I'm going to pass it on to Dr. Lefay to begin the presentation. Welcome.
Thank you, Matt, for allowing me to be part of this Ignite Speaker Series. So my topic is going to be PT everywhere, and I'll discuss the concepts of embedded PT and telehealth. The second you may be familiar with, the first maybe not so much so. So the focus today is certainly to talk about aspects of physical therapist practice, healthcare practice, that challenge some conventional healthcare expectations and provide some opportunities for collaboration and technological advancement, certainly part of the series' focus. We'll discuss the disruptive event that we all know as COVID-19 and how that's provided some opportunities for creativity and innovation in healthcare. And that concept of PT everywhere that I mentioned, it's about where patients and clients work and play, traditional settings, and through remote means such as telehealth. And I'll challenge you right out of the gate to consider ideas that you may have that could make the world a healthier, more accessible place. And a hint here is not to think of needing to be in healthcare to think, make, and ignite your passion through innovation. There are interprofessional opportunities to bring innovation and technology in today's healthcare experience, and hopefully as we talk today, you'll think of some ways that may work for you. So we'll start with the concept of embedded PT. As I mentioned, it's about physical therapists treating and evaluating individuals where they live, where they work, and they play. Not necessarily in the traditional outpatient PT clinic context that you may be familiar with. So we'll also talk about some of those non-traditional settings as well as traditional settings but non-traditional roles. So what are some of the benefits? Well, right out of the gate, to name a few, there's cost savings. And these cost savings are both tangible and intangible. There is reduction in the direct cost of healthcare by having a physical therapist on site. There tends to be a less productivity loss, reduced injury and injury severity rates, quicker return to work and sport, and less absenteeism and higher levels of satisfaction in work and play. There's also convenience and accessibility. When you meet your patients and clients where they are, when they need care, you're able to have a better outcome. And the timeliness goes along with that. Just like watching an athlete go down on the field, an embedded PT is right there to deliver assessment and care when those injuries happen and not weeks down the road. And this isn't just in terms of sports. You also have continuity. So being able to follow someone's path from prevention and wellness to readiness, return to work or sport, examination and treatment, as well as looking at optimal quality of life and performance. These are some pretty notable benefits. You'll see on this slide here, Lieutenant Colonel Drew Contrera. He served for 7 years at the White House as the first embedded PT in its medical unit. And he treated President Obama, his cabinet, senior White House officials, Secret Service agents, and residential staff, anywhere from chefs to groundskeepers to repair personnel. And there are some real additional benefits in terms of this for that sort of embedded PT. Think about the manpower and security that's needed to transport the president and his personnel to and from a physical therapy session at an outpatient site, and the challenges to the confidentiality in bringing that person there during hours that might work best with a challenging schedule such as that. So some other things to consider. Industry. My background is as an occupational physical therapist. I spent years working just down the road in Messina at a General Motors powertrain facility that manufactured 4-cylinder engine blocks and heads. Not necessarily where you'd expect to see a physical therapist. The occupational health company that I worked for was in many different types of industries: automotive manufacturing and assembly, airline, aerospace, tool manufacturing, warehouses, storage facilities, insurance companies, and much more. When you consider those different settings, why would they do this? Well, certainly they wanted to reduce the number of OSHA strain, sprain, recordable injuries, and they certainly wanted to keep their workers working safely and healthily. I touched on in the previous slide some of the employer and employee benefits. One of the benefits that I received by being an occupational PT was certainly the opportunity to collaborate with health and safety, engineering, medical, industrial hygienists, production and maintenance employees, and quality and productivity control to really provide everything along that spectrum that I mentioned: fitness and wellness, job conditioning, pre and post-employment and return to work assessments, first aid, and rehabilitation for both work-related and non-work-related injuries that may impact someone's ability to work safely and be able to enjoy their leisure time outside of work. So the job site analyses and ergonomic assessments and injury prevention training I did were very collaborative events. It taught me a new language. Working with engineers was something that I had not necessarily anticipated having such an opportunity for, and to come together to provide the best possible outcome for employees that were injured really required that sort of team. I knew my employees and I knew their jobs, and I was accessible to them, and my presence definitely helped to reduce both those direct and indirect healthcare costs. So on-site services certainly offer convenience to an employer and to the employee with a lot less disruption to production. There's an ability to go and meet them where they are on the plant floor, in this case, with a worker, to address safe biomechanics while they're actually doing their job, and to certainly address ergonomic concerns right there at the workstation. Being an embedded PT who understands the work task and demands in an intimate way also builds trust and buy-in from employees. So in COVID, many workers in manufacturing, warehousing, and transportation have been essential, and they've been working long hours and under quite stressful conditions. So occupational health PT can help them continue to work safely. So another setting where you might not necessarily consider seeing a PT would be in corrections. Again, think of safety and security, cost, and continuity of care. There is a decreased risk of escape from a trip to town by seeing PTs actually right at the correctional facility. There's less manpower needs, as most inmates would require escort of correctional officers to get to those sessions, multiple trips over the course of a week, and certainly allowing for rapid response if somebody needs care in the moment at the correctional facility. You also see PTs in military settings. These advanced practice PTs in federal roles such as Army, Air Force, and Navy, they can order imaging and lab testing, and just as an industry, they can serve as a really critical point care provider. And they're not just at bases stateside, they're at military installations across the world. There's also an opportunity to be part of the primary care team, making decisions about care, serving as a first point of contact, to triage and liaise with other healthcare professionals both inside and outside those embedded environments. So when we think about hospital organizations, you might think, yes, you see PTs there, but you may not consider seeing them in emergency rooms. So PTs may see patients who arrive in the emergency room as a result of a fall, vestibular issues, low back pain, other orthopedic conditions. And the PTs really can handle managing the discharge disposition for these patients. And by what I mean by that, the PT may decide this person may need additional evaluation and assessment. This patient certainly would benefit from a course of physical therapy or other rehabilitation upon discharge. This person is not currently safe to return home, and then work with the rest of the team to determine whether admission might be appropriate. Another example along that lines is those patients that may have conditions like vestibular disorders, positional vertigo, who typically emergency room care is to simply prescribe them medication and send them home. Emergency department PTs have reduced significantly the amount of patients that have required medication for their care, connecting them with outpatient care and treating them on site in the emergency room to help them regain their ability to function, as well as dealing with the cause of the vestibular condition or vertigo versus masking it. So some other settings will certainly, I'm here as an educator in academia, but you also see PTs working at universities in clinics, sometimes treating athletes, but also sometimes hired directly by the university to treat the rest of the student body or employee populations. You also see them in assisted living facilities, retirement communities, and more. So lots of different opportunities. When you consider innovation and technology with embedded PT, when you treat patients where they live, work, and play, you need to be able to connect readily with other members of the team. You need to be creative, as you may not always have the equipment and supplies you might traditionally see in a fully outpatient PT clinic, and definitely more. So that creativity bodes pretty well to what our conversation is here today. So the other concept that I'm touching on with you is telehealth. So what is it? Simply by definition, the use of digital information and communication technologies to access healthcare services remotely. And you should be familiar with this anyway. Even before COVID, there were elements of telehealth that we all have participated with. So certainly for those of us who live in rural upstate New York, telehealth can make healthcare more accessible. When you have someone with limited mobility, time, or transportation needs, it can certainly make services more accessible, available, and convenient. Access to medical specialists that may be remote from your location, that are not present in your community. It can improve communication and coordination of care across different clinical sites and settings, and certainly provides an opportunity for self-management of healthcare, which we'll touch on a little bit more in a later slide. So technology and practice. So think of the times that you've used your mobile phone or another device to upload information for your healthcare provider, as well as the times where some of that information has automatically been uploaded for you from different devices that may be considered wearables. You've worn a Holter monitor to monitor your heart rate. You've worn a device that monitors sleep apnea. Some of those things will send information directly to your healthcare provider. Some of the things that you may be uploading for your healthcare provider may be food or exercise logs, your blood sugar levels or blood pressure readings. Maybe you're being sent educational videos through a platform that your physician uses in preparation for elective surgeries. Often you're encouraged to download and use web-based or mobile apps to access patient portals, to see test results, schedule appointments, request refills, and email providers. Most of us have done that. Also, you're seeing an emergence of the use of these apps and technology for texting, emailing, or phoning you reminders about appointments and preventative care, as well as looking at the results of some of those devices and identifying when you might need prompts on an individual basis. Think of just your smart phones and your watch-based apps that may give you a vibration every time you've sat still for longer than 15 minutes. So on this slide here, and I apologize if it looks a little bit small, but the American Physical Therapy Association sought input from thousands of PTs and PTAs this past summer. And one of the things that they were looking for is to try to gather some information about how a disruptive event, COVID, has really impacted how telehealth is utilized in PT practice. PT clinics that stayed open certainly in the early stages of the pandemic had fewer consumers walking through their doors, and there were fewer physician referrals and direct access visits and customers, patients and clients that were fearful of being out and about or were restricted by some of the state and national guidelines. By July, there were some signs of progress of people getting back into clinic, but the effects of the pandemic have certainly remained to today. So prior to the pandemic, telehealth was somewhat the exception to the rule in direct PT delivery. Although you would see physical therapists using it in some of the ways we described earlier in terms of scheduling appointments, checking for satisfaction, and perhaps sending some links to educational videos, that one-on-one telehealth where you're engaged with the client through a video platform wasn't really used that much in PT delivery. 98% of PTs surveyed originally said they weren't providing any live video consults. After the pandemic hit, the number of PTs providing these services increased significantly, and almost half reported providing some live video consults by July. And Zoom, like we're seeing in education and everywhere else, has served as the main platform, with about half of PTs reporting using that as their primary modes of communicating with their patients through telehealth options. We've seen a lot of change in the last 6 months in both payment coverage for telehealth, as well as innovation, creativity, and technology, which will be the focus of the last few slides that I have for you today. Although the ability for PTs and other healthcare providers to get paid for telehealth has improved, there's some big challenges, and those are things that perhaps all of you can help us with. Patient satisfaction, outcomes, and payment are really the smallest concerns at this point. There are big technology challenges among patients and clients and clinics that are really a bigger barrier to wider use. 2 of the 3 main obstacles they found in this survey were related to technology, with about a third saying that either patients and clients lacked adequate technology, and about 20% saying their facilities technology was a limiting factor. We also have to consider our older patients who may not be as tech savvy, on top of not having tech in their home. And sometimes the technology is so cumbersome in the level of steps to access it that we increase the amount of barriers rather than reduce them. So on this next slide here, certainly the technology in terms of wearable devices and video-based visits isn't necessarily a completely novel concept. So if we look at that it's more than video-based visits, you may be surprised to hear that the first pedometers were documented as being around as far back as the 1700s. Certainly not what we're used to today, but some iteration of it. And electrocardiograms in the late 1800s. Although quite different in terms of routine use, the ability to monitor critical patient and client vital signs has really been around for years. And a lot of these events have also come from disruptive events. Polio, world wars. These are the things that tend to trigger technology in healthcare and have certainly informed the physical therapy profession. Where the biggest shift is right now is in that miniaturization of these devices into wearable technology. And these wearable technology options have some pretty vibrant transmission functions, not just to your own smartphone or computer, but to be sent to your care provider as well. So this really opens up tremendous options to increase health through their patients, through their awareness of what's happening to them day to day, and empowering them to keep track of these things on their own. This real-time and more frequent monitoring is when it matters, and it's not just during office visits once every 3 months. So if we look at remote monitoring again, so some of these home monitoring devices can detect changes in normal activities such as falls, as well as heart rates during exercise and activity. Those that automatically record and transmit information that you may be using or you may be aware of are those heart rate monitors, some of the blood glucose monitors and insulin pumps, blood pressure devices. There are devices for lung function, gait, posture control, tremors or seizures, physical activity or sleep patterns, and falls. So just a tremendous amount of activity in terms of technology starting to bring these devices into people's homes versus in research lab orientation only. So medic alert bracelets are one thing we think of that does an auto generation of information to a healthcare provider, a healthcare team. And for PTs, one of the things that we're really concerned about is certainly some of the key safety elements of patients at home, their risk for falls, how their gait may change under different circumstances, that posture control, etc. And these devices can also serve as prompts for a patient. I mentioned before getting that prompt from your smartwatch to tell you you've been sitting too long. But patients can receive auditory, vibratory, or text email notifications, as well as notify medical personnel, even when, in very customized ways, as well as being set up in advance at routine intervals. So postural sway and deviations in movement and activity can identify people at risk for falls. And that's huge for physical therapists to be able to identify both how well our interventions are working if someone's not coming to us in the clinic, but to be able to plan our interventions for those that are in the home, and when are these things occurring, either time of day or other activity triggers that may be part of it. The other concept is near falls and balance loss even without that actual fall within an injury. As much as those are important, it's also good to get trigger notification of actual falls, because most of our patients underreport falls, and these sort of devices can certainly give therapists some real-time information that may be valuable as well. So this is a little bit of an image of what a telehealth session might look like between a physical therapist and a patient. And that personal PT to patient-client interaction, that's still a really important part of it. These wearable devices are just a tool that are being used by clinicians to enhance the experience. And what we're seeing really evolve over the last 6 months is access to technologies to share multiplanar or 3D views of movement, exercise progressions, educational tutorials, and personalized instructions that are either in the moment with your therapist, synchronously or asynchronously to be able to go back to them. And there's been tremendous changes in the platforms that can do these things for patients and for clinicians. The ease for the patients to access these sessions are coming through mobile phone apps, embedded links coming from their provider where they're not having to do a lot of work to get onto their sessions, and virtual libraries that are organized in really meaningful ways if someone wants to refer back, and this is becoming much more seamless. Both clinicians and consumers have really wanted more from these virtual experiences now that it's been a very routine part of care. As much of our PT profession is focused on movement assessment and education and personalized instruction interactions, if we have to function on these telehealth platforms, we really need to have them be as robust as possible. And the technology that we use needs to enhance it, certainly not hinder it. So although some of our physical interventions translate not that well to this sort of medium, certainly there are certain things we have to do with hands-on. There are a lot of things that really translate well to a telehealth medium. Movement assessment can be done well on a telehealth platform, postural interventions, looking at range of motion, strength, balance, all of these things have some really good applicability to a telehealth platform. Now here on this slide, this is a relatively new piece of technology that when I was searching I found kind of interesting. And my first response was a little bit jaded, like, oh my goodness, this is going to take away my job as a PT. But that's not really what this avatar is for. They're not replacing PTs. But if you think about technology, think of virtual reality gaming platforms, things like the Wii Fit even. These can really translate well to effective interventions. People like to engage in either gaming or interactions that feel real, feel personalized. So this example here is of a new virtual exercise rehabilitation assistant. We'll call her Vera. And she was created for and by PTs, certainly with assistance of computer programmers and people with a lot more skill in that domain than I do, to allow the patients to engage in a very realistic way with an avatar, even when the PT is not available. And it uses 3D motion capture and oversight to ensure that that there is a quality patient and provider experience. And again, it's not about replacing skilled clinicians, but enhancing care delivery. And so the PT would be kind of monitoring these things. These would be used as supplements as part of the PT at home, and they could be monitored pretty closely. So this again fits really well with a concept we've been talking about today of PT everywhere and to some sense anytime. Both embedded PT and telehealth have the opportunity to allow for people to have access to healthcare both within their homes, within their work environments, and also to have some control over when that occurs, not just during the traditional 8 to 4 you may see in some clinic settings. And so what I would really like to challenge those of you who are alumni or faculty or students that are on here, we are a strong technological school. That is what we do. And you have health science programs here. Where could we go from here? We've had a technology explosion that's come from COVID-19. There's tremendous opportunity for future growth. So I would challenge you to think about how you can be part of those solutions. So coming back to the information I provided you from the APTA, and one of the things that they've said, and that fits really well with the UN Sustainable Goal that we are focused with this Ignite series when it comes to PT everywhere, is that our PT workforce should be better leveraged to improve the health across settings and populations at all times, not only in times of crisis. And so I think that fits well with two areas that we've discussed today. Direct access restrictions must be removed, and what that means is individuals should have quicker and more ready access to PTs without having to go through physician referral and the like to be able to have an opportunity to be evaluated and treated. All PTs and PTAs need to have access to the equipment that they need to be able to provide direct patient care when needed, as well as technology to be able to do it virtually. And that we certainly need to develop long-term strategies for telehealth. And finally, that first question I asked during the beginning slide is while we were talking, or while I was talking and you were listening, is to think in terms of how you can bring innovation and interpersonal collaboration to the table to improve healthcare for all of us. Think about what you could do.
Awesome, thank you. All right, so at this time, if you have any questions, you can definitely start to put them in the chat. We will be reading them off. But I wanted to start with a question, that I had based on, these wearable technologies that we're seeing. Do you see in the embedded PT scenarios, like in industry and stuff, are they starting to use data from wearables or anything like that to start understanding injury prevention even without having to go out on the floor?
Yes, and that's part of the technology that's evolved as some of these facilities have had to move some of their non-essential people off the floor and focus on just who needs to be there. Is some of that monitoring. Some of these wearable technologies, beyond just things like the smartwatches, there's actually clothing that has sensors embedded in them that will allow you to keep track of joint positions and angles and movements that can then be downloaded to software, which allows you to evaluate real-time movements. There's also pressure sensors and other devices that can look at some of the impact from push-pull lift that are sometimes evaluated traditionally by being on site. So absolutely, and there are, and when you look at things that relate to it in terms of air quality and activity exertion, there are wearables that can keep track of heart rate and oxygen consumption, as well as some of those other sort of things that kind of fit into that big picture of ergonomics and occupational health.
Awesome. So we do have an audience question. Peter Miller asks, so with tech like Vera and in an occupational setting, could this be used to ensure that employees who are prescribed PT are following through with exercises advised during treatment?
Yes, certainly you can use those technologies to help provide some of those prompts, and that's some of the concept of empowering the employees. Most of us do better with reminders. Now, if I am the only therapist who's in a facility with 400 to 1,000 employees, or if I am pulled out of it because of, say, COVID precautions, I may need to rely on some of those technology sources to provide some extra input to people. So I think that could absolutely, and there is a novelty about it right now, but I think once the novelty wears off, I think people benefit from having some of those somewhat obtrusive reminders to say, have you moved recently? Are you making sure that you're keeping your elbows in close to your body so you're not straining your shoulder while you're doing X? Did you remember to do your warm-ups before you started? Think of our GPS in our cars, how we readily follow those directions that are coming to us. I think there is a lot of people are very responsive to having some of these sort of resources provide them some cues and prompts when a person cannot physically be present.
Yeah, and I think that kind of lends itself to a question that I had as well. There's definitely a lot of novelty with some of these technologies, but everyone has a family member or a friend who probably is going to PT, and then they're they're only meeting maybe once a week, and they're supposed to do stuff at home, and they just don't end up doing it. So do you think that long term you'll see a decrease in recovery times based on maybe some of these technologies are actually encouraging people to do their exercises at home?
I think anything that can encourage compliance with a home program so that people are following a path that has been designed to provide an optimal outcome, the more that patient is able to be an active participant in it, whatever that technology is, if that technology enhances their ability to be more compliant with that program and to adhere to it, absolutely. Because it's a patient-therapist collaboration. What I do or what another therapist does in the 45-minute to 1 hour session 2 to 3 times a week is only as good as what the patient is contributing to that same process during the time that they're away from the therapy session as well.
Absolutely. Another question that I had was, do we think that, what industries do you think that telehealth is going to remain extremely important? Like, do you see any, such as, maybe K through 12 education or some of those other industries, do you see them going back to a predominant in-person treatment process, or do you think that most PT will have at least some telehealth presence?
I think you're going to see a telehealth presence remain in traditional sort of outpatient care. I think that as it is evolved and shown to have benefit and applicability, you'll see people that have had some of those, not just right now because they are concerned about exposure, but to say, I'm having good outcomes. By being on site one time, I'm decreasing the cost of transportation to get there, the cost of parking for my session, the cost of childcare because I have to make those arrangements before I leave to go to my therapy session. The inconvenience, the time away from work, if they could go and do this during their lunch hour versus driving half an hour to a clinic and then losing time at work. I think you'll see people elect to do it even if it's not always the direct platform.
Do you see any real, what am I trying to say here? There's some real challenges you were talking about a little bit, broadly speaking, with telehealth and some of the technological barriers that you see. Can you dive a little bit deeper into what those actually are? Like what are the real challenges that you're seeing? What are PT practitioners running into on a daily basis right now?
Well, early on, and I think still to some degree, bandwidth.
Okay.
There's so many people using technologies that they're running into issues with, the swirling wheel of death while you're connecting. So I think there's definitely, especially in areas where we sometimes don't even get 3G up here, let alone 4G, and that some of the internet provider options are not super robust. And there is a cost involved. And so you may have patients and clients that don't have internet access, or they have limited internet access that might have been fine before everybody was using these systems for their kids going to school and for their own online work. And now those systems are not necessarily, that infrastructure is not really there for some of the connectivity needs. So that's definitely a barrier. And, I think we lose sight of the fact that there are a lot of people that aren't tech savvy, that beyond not having great internet connections, do they have a phone or a laptop or PC that is reliable for them to use? And do they know how to use it? A lot of the patients that are fearful of getting out and resuming traditional services or going about their day are often, and should be, are older patients. And that's the generation that may not be as comfortable with accessing the technology and be a little intimidated by that process. So making sure that our patients have the resources they need to participate, both in terms of internet connectivity as well as devices that allow them to engage, but also the simplification of the technology so that you don't need to have a real level of literacy, tech literacy, to participate is an important piece.
So what I kind of hear you saying here is that not only is connectivity is kind of a baseline problem that everyone's running into across all industries right now. There's plenty of things out there about with kids at home doing education and parents trying to work. There are those issues. But from a device standpoint, sometimes I can imagine that, tablets and computers, not only are they kind of more complicated than what you need them to be, but also I would imagine that if a patient doesn't have something like that for telehealth, I imagine that insurance companies won't necessarily pay for that as part of
At this time, no.
Yeah.
But we're seeing those changes. We're seeing insurance companies starting to reimburse for some wearables.
Okay.
That knowing that real-time information going to their provider is important for them to have. So we're starting to see some wearables translate to being reimbursed. But paying for someone to have a laptop or tablet to be able to participate in virtual telehealth sessions, that may take some time. Yeah.
Do you think that something like Vera, where it's only meant for that thing, if it was maybe part of the PT prescription where you're supposed to do it from home, in addition to using this equipment, you're going to have this home assistant. Do you think that would help with kind of the adoption from insurance companies if it was only meant for at-home care?
I'm not sure. That's a good question. I think in some ways, just the opposite.
Oh, really?
Where I'm thinking is in terms of, we've talked about telehealth in terms of PT, but we know that it's not just PT. It's for example, a lot of routine medical visits, whether it be annual or biannual physicals or appointments with specialists, have moved to telehealth platforms. Part of me thinks that someone having access to a relatively reasonably priced tablet to participate in all of their care, not just like very specialized piece of care. So, the insurance might say, we'll purchase this is hypothetical, a tablet which will allow you to participate in your virtual telehealth visits with your primary care physician,
Gotcha.
with your physical therapist, with your occupational therapist, for consults with your pharmacist, where I almost think that they'd be more likely if they know that it is something that is going to be sustained across multiple healthcare providers, and that technology will allow them to participate in multiple platforms, not just one particular niched need, even though certainly that has tremendous benefit. I think in terms of the insurance company paying, they want it. I think it's more of a bang for your buck sort of premise.
So another question, going back to the wearables. So are there, there's a lot, like you were talking about, a wide breadth of wearables out there. Are there any things that aren't currently tracked by wearables that would be really helpful for in a PT setting? Like, are there any stats that PT practitioners would love to see more about with patients?
I think that there's most patients don't necessarily have access to some of the sensor-based things that I'm talking about, where you can really be able to get a robust assessment of their movements from a kinematic perspective.
Okay.
Where they may be wearing something on their wrist or sensors in their shoes, which give you a picture, or the video camera might track points. But it would be really, really nice if that there were, there was a little bit more adoption into things that would be, and there are out there sensors that can be placed on someone's clothing or directly on their skin, which the software for the camera system on the computer would automatically calibrate to those points and then be able to track information about movement. That's not necessarily as much of a routine part of practice right now. A lot of the telehealth is more allowing the patient to see the therapist as well as to have supplemental screens or images so the patient can see the exercises in different movements and planes. but not necessarily to provide much real-time data back to the therapist beyond, like I said, some relatively limited app-based technologies.
Yeah, because in a traditional PT appointment, you'll be trying to do different positions or movements, and they'll be constantly kind of adjusting you to make sure you have it right. So I imagine, with the camera,
the nuances are harder. I think that the technology is progressing, and I think you're seeing some of that really robust stuff more in research labs or in clinic environments. But certainly to see what that great technology translate into low-cost, reasonably accessible stuff that either a clinic can say, this is how you're going to use this when you do your home sessions. Be able to send them home with a kit, a tech kit, essentially, that they can then be able to use to enhance the experience during those other times. Right now, those things are kind of moving. A lot of it comes down to cost.
Yeah.
Making these things relatively low cost, so either they're covered by the insurance or where the clinic has them to loan out to clients for their sessions, so that it enhances the experience for both the therapist and the patient.
Well, and I imagine that, again, once we start adding technology, it's also going to become about accessibility and, how easy is it to use. If they have to put a bunch of different sensors on them, is it going to be really, plug and play or whatever?
Yeah, and I think right now, even just the very simple, being able to have FaceTime with a client, whether it's simply like what we're used to with Zoom, to be able to talk to someone, have them be able to ask questions directly, being able to have them set up the camera, even if it's a limited viewer angle, to have someone watch them move. The more we can see, the better the quality of the image. All of those things certainly matter, but it's the connection piece that matters. So whether it's simply the limited tech that we get from Zoom, where you can actually be able to make eye contact with someone over a video platform, even that in and of itself is far superior to trying to do these things over telephone calls or email communications, or simply not seeing them at all. So it's, all of these technologies certainly have ways to really allow for good quality outcomes from a virtual medium. But again, a lot of it comes down to keeping that patient and therapist or patient and clinician relationship going and have that connection, because that's also a big part of adherence and compliance. The technology can work really well to supplement it, but there has to be that relationship, that alliance, therapeutic alliance there too, and that's part of making, it may not be live, but there is satisfaction of making contact with somebody, even if it's a virtual medium.
Yeah, great. Well, those are all the questions I had. I'm not sure if the audience has any more questions for you. Oh, it looks like we do have another question. Pete Miller asks, the auto and construction industries have begun to adopt a different type of tech to assist with repetitive lifting, exoskeletons, such as exoskeletons. Does the PT community have an opinion on these? Are there some unintended consequences to the body in wearing them?
I don't necessarily know if there's some kind of broad PT community statement and belief to that. I think there is, perhaps in my sense, that there is a time and a place for a lot of different things. I think sometimes those technologies, some of the robotic exoskeleton things, are designed to enhance someone's safety. But the technology comes at the potential for risk. That if that tech is to break down and someone is in the middle of some sort of repetitive activity, there is that potential versus teaching the employee to work safely. And I've seen in the automotive industry robotics used to replace workers. So I think there is, if anything, there is some stigma related to that in industry. So I wouldn't necessarily say that there's a PT sense for that. I know that I do have some reservations about the use of bracing and external supports, whether it be back braces or other things, that sometimes it can lend an employee to have a false sense of security in their abilities, which sometimes can predispose to more injuries. So I think the exoskeletons have tremendous potential to allow people to do jobs that with less physical risk in the moment, but they certainly should be things that we look at very critically in terms of if they're sustainable, if they're safe, if there are lockstep mechanisms to ensure that employee is safe. If that's what Peter's getting at with his question.
I think that sounds about right.
Yeah.
Great. Thank you very much. I think if there are no more questions, I'll give it another few seconds here. Well, while we wait for that, I would just want to say thank you again for joining us. This was a great conversation.
Opportunity.
Yeah, and thank you all for joining us. I think this is going to wrap it up for us this week. I'm glad that the link is working again, and hopefully we can continue to have some success with this as we move through the last 3 or 4 sessions. So thank you again for joining us. Have a great week, and we hope to see you next week. Thank you.
Thank you.